Possible reasons for occurrences. As of now, it isn't possible to specifically pinpoint an exact cause for breast cancer. What we do know is that breast cancer is caused by damaged cells. However, there are several factors that can increase your risk of getting breast cancer. There are both controllable and uncontrollable reasons for getting breast cancer. Controllable examples are alcohol consumption, lack of physical activity, smoking, being exposed to radiation, and being overweight or obese. Uncontrollable reason examples are your age, race, genetics, and family history. The number of affected people. It varies from country to country, but at least in the US, breast cancer rates have been increasing since the late 1980s. Then it then began to decrease in the early 2000s. However, these rates have remained stable since 2004. And, being stable is not as good as continuing decrease, but it's definitely better than an increase. However, death rates have decreased 39% from 1989 to 2015, so that's really good news. However, in the UK, the breast cancer rate has been increasing since the early 1990s, and it's increased by a margin of 20%.
Diagnosis. The first test administered is a biopsy. This test removes cells from the area where the abnormal growth is formed. This is usually done if there is a lump of some sort that has formed anywhere in the breasts. The results are put in the pathology report, which tells of the cause of what is making the abnormal growth to form. If the growth is malignant, then it's cancerous and it can metastasize or travel to other parts of the body. If not, then it's benign but can still grow bigger. If it is benign and still grows, then it can be removed via surgery. Genetic testing can be done, but this is typically done for those who have the BRCA1/2 gene.
Breast cancer incidence rate by counties. Between 2010 and 2014, there was an average of 14,854 incidence report cases of breast cancer in the state of Texas. Out of the top 5 counties, Harris County reported the highest number of average new cases for breast cancer with 2,304. That's almost 1,000 more people than the next county. Harris was 2,304, Dallas was 1,378, Tarrant was 1,110, Bexar was 999, Travis was 571. This is my pie chart showing the percentage of average new breast cancer cases in Texas by the county. These are the top 5 counties in Texas and a complete pie chart of those counties. Breast cancer incidence rate in Texas. The incident rate in women for the state of Texas is 111.5 cases. While this number is the highest incident rate for cancer in women of Texas, it's only the second leading death rate in women with 20.2 cases. By the end of 2018, there will be an estimated 18,260 new cases and an expected 2,880 deaths in Texas. Death rate was reported from 2011 to 2015 and was per 100,000 women. 2015 was the latest year for the death rate report available. Breast cancer incident rate in the U.S. About 1 in 8 U.S. women, which is about 12.4%, will develop breast cancer over the course of her lifetime. The number of new cases of female breast cancer was 126 per 100,000 women per year. The number of deaths was 20.9 per 100,000 women per year. Breast cancer represents 15.3% of new cases of any type of cancer reported in the United States. Breast cancer by the end of the year. By the end of 2018, there will be an estimated 300,000 women who will be diagnosed with breast cancer in the nation. About 41,000 of those women are expected to die from the disease by the end of 2018 also. Even with these stats, the survival rate has improved greatly in nations that have access to medical care to get early detections. The risk of breast cancer, however, tends to double until the beginning of menopause, but breast cancer is also more common after menopause.
Ethnicities, age groups, and facilities. The group of people most affected by this cancer are Caucasian women, followed by African American, then Asian Pacific Islander. Between these groups, African American women have a higher rate of developing breast cancer than Caucasian and Pacific Islander women. The older a woman gets, the more she's likely to get breast cancer. The age groups that are most liable to this are between ages 50 to 80. Women ages 50 to 70 are eligible for breast cancer screening on the NHS and should have appointments set up every 3 years. Finding testing facilities is difficult because rates change due to a person's health insurance, budget, cultural, and language barriers, as well as a lack of recommendation from a provider for a mammography screening. How to reduce chances. There is no true way to reduce breast cancer, but certain things can be done to reduce the risk of it. One thing is to stay healthy, wait, and not eat a lot of junk food. Junk food has a lot of preservatives that can increase fat tissue, and this can increase the risk of not just breast cancer, but any cancer. Limit saturated fat and overall fat in diet, as said, and eat plenty of fruits and vegetables, as well as food that is high in omega-3 fatty acids. These fatty acids are good for the body and are needed too. Limit alcohol as well, because this can also lead to too much fat being collected in the body. It's important to check your breasts regularly to see if there are any abnormal lumps that are not there before. This way, if there's one, then the time of its formation can be approximately pinpointed. You can do them as often as you want by conducting a breast self-examination on yourself. Professional screening can be done too. This varies with differing ages. Early detection can help with finding out when the cancer started, and it can possibly be stopped from spreading all over the body too.